Contrast and CT scan of a 25 years old male patient. He complains of evening rise of temperature with shivering for the last 8 to 9 months. He also complains of pain in epigastrium and both lower flanks. The patient has lost weight of about 25 kgs over the past 9 months. Now, there are typical features of abdominal tuberculosis. Now, please observe these small hypodense lesions in the upper part of the liver. These one here. These represent tuberculous abscesses. Now, as I scroll it low down, this is the thickened parietal peritoneum. This one here, its maximum thickness was approximately 7.2 mm. This thin rim is the ascites. Now, I scroll it back up again. Now these are the enlarged lymph nodes along the lesser curvature of stomach. Now please observe typical features of marginal enhancements and central necrosis. These are very typical of the tuberculous lesions. Now its density is approximately 7 HU. Similar enlarged lymph nodes are noted along the head of pancreas, head portohepatis. This one here, this is the head of pancreas. These lymph nodes here. No, these one here. Typical features of marginal enhancement and central necrosis. Now, similar enlarged lymph nodes are also present in left para-aortic region, in inter-aortocaval region, in retrocaval region, this one here adjacent to the right crus of diaphragm. All these lymph nodes. Multiple sub-centimeter sized and few slightly enlarged lymph nodes are also present in the mesentery. Now, as I scroll it down, please observe that the density of greater omentum is increased. Its thickness is also increased. This one here. This is very typical of the tuberculous etiology. Normally in metastasis, the thickening of greater omentum is relatively more and nodular masses are present inside the thickened greater omentum, or it has nodular configurations. Now please observe the smudging of the intestine. Now this is a slight thickening of the wall of terminal ileum, distal ileum is present in this region. Please observe the appearance of the small intestine. This wall is very thickened mesentery, and this wall is very suggestive of the tuberculous etiology. Ileocecal junction is normal. There is no intestinal obstruction. Ascites is present. So the findings are very typical of the abdominal tuberculosis. This is the coronal scan. Please observe the mesenteric lymph nodes, para-aortic and pericaval lymph nodes. This one here, thickened mesentery. Now this is the thick-walled ileal segment here, this one. The features are very typical of the, now these are the extrarenal baggy bilateral renal pelvises. This is the sagittal scan. This is the delayed scan. Please see this thickening of wall, thickened, enhancing mesentery. These all are slight thickenings of walls of the small intestine.